Joining us live to discuss the governor's message and the work still ahead for all of us is Dr. Mark Fox from the St. Joseph County Health Department. Sir, I trust you just listened in to the governor. The current COVID restrictions will remain in place until April 5th. But as of the 6th, the statewide mask mandate will be over and it becomes an advisory, no longer mandatory. Are we ready for that step, in your opinion?
Brian, unfortunately, we've been on this road before. We saw the governor move too quickly at July 4th. We saw the governor move too quickly September 25th with really devastating consequences. There was an awful lot in the governor's speech tonight, and the one thing I didn't really hear him talk about, in fact, I'm not sure it was even in the text of his speech, was any mention of the more contagious variants that are present in the state. And, it's great to open up access to vaccine eligibility to everyone 16 and over, but we don't have the capacity to vaccinate all of them in the 5 or 6 days before we return to the Wild West and throw everything wide open. So on the one hand, I'm glad he puts some more authority in the hands of the local health department, but it also abdicates a fair amount of responsibility. So we're going to have to make some tough decisions and review our policies, both around venue capacity and other challenges in light of, still a pretty tricky situation with access to vaccines and the emerging variants.
You have had a very difficult job. Health officials all across the state, all across the country and around the world for that matter. Does this announcement today make your job, the hospital's jobs, healthcare workers' jobs, harder moving forward? Do you fear another surge later in April, May, June, July if we throw the doors open here in Indiana?
I want to be clear that, I'm not trying to provoke hysteria. I don't think we're going to see a surge like we saw in November, but in every public health class I ever took, they never said you have to do 93 different interventions at once, open up vaccine eligibility, take away the mask, remove venue capacity limits all at one time. I would have much preferred to see an incremental approach saying, let's make the vaccine available to everyone. Let's make sure we have effective mechanisms to roll it out to a greater proportion of the people. Then when we're a little further along in that pipeline, then we can start to open up on other things. So it could have been an incremental approach, which I think would have been much safer. And instead that abdicates the responsibility to make those difficult decisions and play the bad cop, frankly, left to the local health departments.
And then you wind up getting the wrath from people who don't necessarily agree. The one exception the governor noted on the mask mandate is for schools. Students, teachers, and staffers required to keep their masks on until the end of this school year. How do you feel about that one?
I think that's critical. So I am thankful that he specifically singled out K through 12 schools because, the bulk of that population will not have been vaccinated because no one under 16 is eligible with the currently authorized vaccines in the United States. So I think it's absolutely critical, and I am grateful that he did single out K through 12 schools.
The governor did talk about, getting more people vaccinated and that surge he expects in vaccine supply. And he talked about some new company-based coronavirus immunization clinics, getting companies and businesses to get their employees, employer-based vaccination clinics. Do you support that idea?
I do. I think that's a great way to, especially the large employers can get hundreds or thousands of employees. The educational institutions, so colleges and universities, can get their faculty and staff and students immunized. So I do think that can be a very effective mechanism. Ultimately, though, we've got to get the vaccine into the private docs' offices because there are a lot of patients who will get a vaccine if their doctor recommends it and has it available, but they're not going to truck over to St. Hedwig's or to some other mass vaccination site to get it. They really want to get it from their own doctor.
Dr. Mark Fox, thank you as always for your time, your expertise, and your very frank thoughts on the governor's address. We appreciate your time, sir.
You bet. Take care.